Antibiotic suspension for newborn babies. A newborn baby is more susceptible to infection because of its low immunity. Your newborn was given antibiotics through a drip in hospital after birth because of a possible infection. For proper treatment, your newborn needs to finish the course of antibiotics. This no longer needs to be done in hospital, but can be done at home with an antibiotic suspension. The pediatric ward is always available to answer any questions you may have. Give the antibiotics 2 times a day, for example at 9 in the morning and 9 at night, before feeding, so that the newborn still has a need to suckle. Keep a record of when you give the antibiotics. How do you give the antibiotics? Draw the correct amount of medicine into the syringe, as shown on the label or in the leaflet you were given. There are 2 ways to give it. Method 1. Inject the correct amount gradually into the cheek pouch, letting the baby suck on a teat or finger in between. Feed afterwards. Method 2. Inject the antibiotics into a bottle teat and let the baby suck on it. Make sure your baby gets all the antibiotics. Then give the bottle. Do not mix the antibiotics with food. Does the baby vomit within 30 minutes of ingestion? Repeat the dose. A mouthful of spit up is not a big deal. Problems such as diarrhea and cramps can be caused by antibiotics, but the natural variation in your baby's stools makes it difficult to tell if this is the cause. Have you missed a dose of antibiotics? Is it less than 4 hours before the next dose? Take the dose anyway. Is it more than 4 hours before the next dose? Skip that dose and take it at the end of the course. Keep a close watch on your baby and call your pediatrician if he or she develops any of the following symptoms: temperature above 38 or below 36 degrees, refusal of food or antibiotics, increased spitting up, sleepiness while feeding, side effects such as allergic reaction with rashes. If you have any questions or concerns during the treatment period, always call the hospital pediatric unit, not your midwife or GP. The hospital can be contacted day and night. The number is on the leaflet that comes with your medicine. Not found? Call the reception and ask to be put through to the children's department. This animation was created by Pidio.nl and developed within the Protect NEO project that aims to improve care for newborns at risk of infection. More information, see neoinfectes.nl.